welcome to Dr. Akinclicks and I am Dr. Akin. Today I am going to share with you what is white coat hypertension. Remember that when we are in school as a student, if the principal of the school calls us to his office, we feel anxious thinking why the principal has called me to his office. Or if we are working in an organization or office, when the boss of the office calls us, or in a family, when the elder calls us for a discussion, whether we know the topic or not, we still feel why my elder has called me for a discussion, and we become anxious and our heart starts racing and pounding. So this is something similar to a white coat hypertension. So be with me till the end of this video to know what is white coat hypertension. I am going to tell you in detail. Whenever a patient visits the hospital to meet the doctor, whenever a patient goes to an outpatient clinic of the doctor to see a doctor, while visiting the hospital or doctor clinics, especially when a patient waits for his or her turn to consult the doctor in the doctor's clinic, the patient keeps thinking, what will the doctor say about my illness and how will it go during the discussion with the doctor. So the patient becomes anxious, the patients become excited, sometimes worried, thinking what will be the outcome of the disease consultation with the doctor. What will the doctor tell me? Will it be a very simple issue, or will my illness be a complex one, especially when waiting for the doctor to be seen? So we become anxious, sometimes excited, and our heart starts pounding, our heart starts beating fast, and our heart starts racing in some patients and in most of the patients. So when you visit the doctor's clinic, when your turn has come and when you are called into the doctor's chamber or doctor's clinic, and especially when in a very busy scheduled OPD, outpatients department, and as soon as you enter the doctor's clinic and the doctor measures your blood pressure and doctor says, your blood pressure is very high, it is in the hypertension range. So then even you will be more worried, and even again if the doctor wants to recheck again, then also your blood pressure will be elevated and your blood pressure will be recorded in the hypertension range. This elevation of your blood pressure, and your blood pressure being recorded in the hypertension category in the doctor's clinic is known as white coat hypertension. You remember and you also know that in the hospital, in the health facilities, the doctors wear a white apron which is called white coat. Even the nurses and other medical staff also wear white coat or white apron. But especially when you visit the doctor's chamber, when you are in a doctor's clinic and when your BP is recorded and your blood pressure is recorded to be in the hypertension range, then it is called white coat hypertension. So remember that when you go to doctor's clinic and when your BP is recorded to be in the hypertension range, and when you also notice that your blood pressure is recorded to be normal outside the doctor's clinic, then you remember that maybe you are having white coat hypertension, that is your BP is elevated to the hypertension range in the doctor's chamber, in the doctor's clinic. So what you have to do is that you go back to your home, you go back to any other health facility where the doctor do not check your blood pressure. If possible, you get your BP recordings in your home and you record it in a note sheet, and then on multiple occasions you record it on the note sheet, your BP recordings on multiple occasions, and then next time again visit the doctor's clinic. Again, if the doctor checks your blood pressure to be high in his chamber, in his clinic, in his outpatient office, then you show your blood pressure recordings of your home in other places where the doctor is not recording your blood pressure, and tell the doctor, whenever I record my blood pressures, whenever I check my blood pressures outside your clinic, whenever I record my blood pressures away from your clinic in the home, or when any other person who knows how to record BP, when I get it recorded, I have these values, and the values of the blood pressure recordings on multiple occasions are within the normal limit, and you show the recordings to the doctor. Then if the doctor once again checks your blood pressure in his clinic, and if he finds your BP to be elevated and in the hypertension range, then the doctor also may think that maybe you are having white coat hypertension. That is, your BP is elevated, your blood pressure is in the hypertension range only when you visit the doctor's clinic. So the doctor may ask you to rest for a while quietly in his chamber in one place, or doctor may advise you to wait in the resting place of the clinic for 5 to 10 minutes, and then he will check your blood pressure once again. And if he finds that after 5 to 10 minutes of resting after seeing the doctor, if your blood pressure recordings are within the normal limit, then the doctor will also surely tell you that it can be because of the white coat hypertension. So next time when you visit the doctor's clinic, if you are visiting the same doctor, the doctor will make you comfortable, will spend time with you, and after having spent time, after having made you comfortable, say after 5 minutes, the doctor may check your blood pressure, and after 5 minutes or so, if he checks your blood pressure and when your blood pressure are recorded to be within the normal limit, then the doctor will surely think that the previous recordings in his chamber, in his clinic, when the BP was elevated, must have been because of the white coat hypertension. In India, especially in many of the developing countries, the outpatient clinic, the outpatient OPD numbers are huge and massive. Each doctor sees in the outpatient clinic more than hundreds of patients. So sometimes it is difficult for a doctor to spend just 5 minutes or 10 minutes just to see that your BP is recorded after 5 or 10 minutes may be difficult. But what you can do is that when you visit the doctor's clinic just before that, or you reach the doctor clinics 5 to 10 minutes before or 10 minutes before your appointed time, so that you can rest there in the waiting area. In the meantime, when you rest, your BP will be falling towards the normal limit as you get accustomed to the surroundings of doctor's clinic or doctor's chamber. Remember that it is found that among the hypertension people, among the people who are having hypertension, around 20 to 25% of the people who are having hypertension are found to have white coat hypertension. Basically, BP is elevated only in the doctor's clinic. Therefore, it is very important for you to get your blood pressure checked in your home or other than your doctor, and get all those blood pressure recordings on multiple occasions and show to your doctor whenever you visit the doctor's clinic, telling that, doctor, my blood pressures are recorded to be normal when I check at home by a person who knows how to record the blood pressure. This will help the doctor also to judge whether indeed you have white coat hypertension. So if you like this video, and if you are watching this video, or if you are visiting this channel for the first time, please like, subscribe and press the bell icon to receive latest regular updates whenever I upload a new video in this channel. Thank you.